Hi, I'm Dr. Chuck with Your Filthy Mouth. Today we're going to be talking about early signs of dental problems. What are they? Maybe not what you think. Stay tuned.
Your smile is beautiful and possibly deadly. Dr. Chuck is here to tell you how your mouth can hold the key to your overall health. Now, about that filthy mouth of yours.
Welcome to Your Filthy Mouth. Suzanne Lynn here with Dr. Chuck, and kind of proud of myself because I did a lot of homework for this show. This is the early signs of dental problems, and I'm just going to kind of throw these out to you for your thoughts. So early signs, I'm told from the internet: mouth sores, jaw pain, redness, swollen face or gums, tooth sensitivity, broken teeth, dry mouth, bleeding gums, bad breath.
Those are all later signs.
I imagine that the internet's wrong. Okay.
No, what happens though is we think that if something doesn't hurt, if we don't see anything, there's no problems.
Right.
But there's things going on for a long time before we have signs of that, before we know there's something going on. So I guess you are right in the fact that these are signs that you're going to see. But that's
not that early.
No, they're not that early. They've been going on before you can see that.
Okay. You're on stage here. What are the early signs?
Go through your list.
Wait. Okay, so mouth sores.
Chances are you've had that mouth area in there for a little while. Only recently has it become sore, or were you aware of it?
Okay.
And so, what's causing it? Was it caused from a virus? Did you bite yourself? What's causing that? So, again, the fact that you feel pain is the very last thing that comes along something. In fact, I was talking with a physician just a couple weeks ago, and he was saying that the last thing you get is pain. You have all these problems along the way, and then finally something hurts. So the little red light goes on. He says, I got to do something about that. So there's probably been something going on way before the pain.
So if you went to the dentist and he diagnosed that you've got, this, I don't know what you call it, besides a mouth sore. I'm sure there's a medical term for it, but he could have called it before it got sore, or she.
Well, gum disease, periodontal disease, which is very, very common, and I'll throw some numbers out there. According to the Center for Disease Control, over about 50% of the population has it. If you're over the age of 65, 70% has periodontal disease. There's no pain, doesn't hurt. So if you're waiting for the bleeding gums, if you're waiting for these things, you might not see it. It's been going on for a while before you had that.
Interesting. Yeah. Okay, jaw pain and redness.
Well, same thing. Redness is only going to show up if you're looking for it. Okay, you can have a red area back there going on for months before you even pull your cheek back and take a look. How many of us take a look inside of our own mouths? How many pull back the curtain of the lips, take a flashlight, and look around and see what's going on? Not many.
Never. Yeah.
That's it. Yeah. Well, but if you had a wound on your leg, or when you're taking a shower, you're looking at your body, you're making sure everything is clean. There's no, if you see a bruise or a cut, I wonder how I got that. You look for it.
Sure.
You never see it inside your mouth. You don't pull the lips back. You don't pull the cheek back. You don't take a flashlight in there. Maybe we should. Maybe a little more often.
Interesting. Let's see. Swollen face or gums.
Swollen. You've had the problem way before you had the swelling taking place. Okay. The infection was already there. Finally got big enough to where now you can start seeing the swelling. And a lot of times you'll have the swelling and no pain. Okay. Because what causes most pain is when you start building up pressure. When you can't get the swelling, then you build up pressure inside, and that's painful. But once you get the pressure, once you drain the fistula, once you pop it and the pressure is released, a lot of the time the pain goes away. But you can have swelling without the pain, but it's not okay.
What's causing the swelling?
Usually infection. Usually it can be other things, but usually it's going to be some type of infection. It could be infection of the teeth, infection of the gums, infection of the sinus, some other type of infection going on.
That is definitely, so far everything we've talked on is definitely sounds like down the road. Those are not early signs, like it's happening. You're already starting to see the manifestation of it.
Well, it's been happening before you had the signs. So I guess we can say those are early signs, but it's been going on for a while before you had the sign.
Tooth sensitivity and broken teeth.
Same thing. The broken teeth can be caused from a lot of different things. You've got decay going on with the tooth. You've got a weakened filling. You've got a bite that's out of whack. You're banging on the tooth the wrong way. Those are all problems before you have the sign. When you break the tooth off, then you can say, oh, there's decay going all underneath there.
Oh, wow.
Or you say, well, look at the way your teeth were coming together. You were banging on that tooth. Eventually, it's going to break. So again, that's the end result. But there was a problem way before you had the sign.
Okay. Dry mouth for early signs.
Again, that's an early sign. Why do you have the dry mouth? You know, and there are different things that can cause a dry mouth.
Okay.
Medication is really high on the list. There are over 400 medications that are going to dry out your mouth. So you're on the medication, you get a dry mouth. Is the dry mouth a sign of a problem? Yeah, because now you don't have the saliva to dilute the acids that are being produced in the bacteria, so your cavity rate goes up and your gum disease rate goes up. So again, it could be, you could call it an early sign, but the problem was you had to take the medication, which dried out the mouth. Or if you had radiation, that's another thing that'll dry out the mouth. That's a horrible thing.
Radiation.
Radiation. Yeah. You're killing those salivary glands in the area, and so you get a dry mouth. They actually make fluoride trays or other things for people to help cut down on cavities when they've been through radiation treatment.
And then bleeding gums and bad breath.
Again, those are signs, but things have been going on for a while. Bad breath is generally, most of the time, a sign of gum disease, periodontal disease. But that's been going on for a while. So yes, it is a sign, but it's not an early sign. You've probably had that gum disease going on for weeks to months to possibly even years, but no pain. So a lack of pain is not a motivator. That's why the older I get, the more I like pain. I never want to cause it, but boy, it's a great motivator.
You know, as your patient, I'm really glad to hear that. So, all right, we're going to come back with a question of the week.
Here's Dr. Chuck's question of the week.
Hey, this is Maureen. Could medicine be affecting my teeth coloring?
Maureen, great question, and welcome back to Your Filthy Mouth. About the teeth coloring, what do you think?
Can medicine be affecting my teeth color? Well, especially years ago when they would use tetracycline as an antibiotic for young children when the teeth are still forming. That was a very common problem. You'd see a gray or a really dark brown color of the teeth, and that the tetracycline is actually incorporated into the developing tooth. And those were really tough, and it's just about impossible to bleach that color out of the teeth. So yes, that can be a real problem on that, the medicine, the tetracycline. They don't use that on children anymore because of that reason.
Okay.
But there are certain oral mouth rinses, for instance, like Paradex and some of these others that you want to use just temporarily. You don't want to use it long term. But a lot of times people say it turns my teeth brown. Actually, what it's doing, and this is what I've been told anyway, is that you're staining the bacteria on your teeth.
Oh.
So the bacteria are turning brown, and that's what you're seeing on your teeth. It can be polished off. We can get it off of your teeth. But because I want to use this, my teeth turn brown. That's because you're not removing the bacteria, the plaque. I'm getting back to disclosing
Yes,
tablets.
I knew we were going
solution.
there. I love it, yeah.
Yeah, because if you'll properly get the bacteria off your teeth, you're not going to get that brown stain.
Good. Awesome. Maureen, we're going to send you Your Filthy Mouth mug. Anytime we use your questions, we'll send one out to you. Might even put a little bit of chocolate in it. I don't know. We'll see how. I don't know if it's a good idea in the summertime to send out chocolate in the mugs.
Well, it just makes you can eat the chocolate, but just clean your mouth when you finish.
That's
you know?
right. Okay, so we're talking about the early signs of dental problems and kind of, I don't know, as myth busting goes, pop, 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 all the way down the line. Because you're saying a lot of the things that I brought to your to question, mouth sores, redness, tooth sensitivity, dry mouth, you're saying that those are not typically early signs. They've already manifested themselves.
Those can be later signs. Okay. You've had a problem going on for weeks, months, and like I said, even years sometimes. And now you're finally getting some of these symptoms. And so, gee, I better get this checked out. Well, if you would have got this checked out, 6 months, a year, 2 years earlier, maybe we wouldn't have that problem. The number one reason people don't see a dentist, lack of pain. Nothing hurts. I'm fine. I don't need a dentist. this is why the older I get, the more I like pain, because it's a great motivator. But we don't want you to have any pain. That's not the idea. The idea is not to get pain, to do the prevention to where we can avoid the cavities, avoid the gum disease, and so much more, because this is the stuff that gets into your bloodstream. And that's the whole reason we're doing this podcast, is we can connect the dots between the mouth and the rest of the body, and people understand that, hey, that bacteria in my mouth, it doesn't stay in my mouth. It goes to my bloodstream, and it goes from my heart to my brain, my pancreas, everywhere. So again, we're back to keep your mouth good and clean. That's a great thing to do.
So if you had to say the very bottom line of this show, early signs of dental trouble are signs that your dentist is going to see, technically, right?
You really need an examination from a qualified dentist. I've said this before, there's some excellent dentists out there, and there are other than good dentists out there. So you've got to be careful who you go to. This is the same with physicians, the same with auto mechanics, the same with electricians, the same with house painters. There are good and there are other than good. And so you've got to be a little bit picky. This is your health. Sometimes if you make your decision simply on, well, this is where my insurance says I have to go, it might be a great choice. It might be an other than great choice.
You're so positive. It's so nice.
So, yeah, be careful.
Yeah. Dr. Chuck, thank you so much. And please subscribe to the show so that you don't miss any episodes. And most importantly, share the information with your friends and family and network, and let them know how important good dental care is.
Well, this is the front door to your body. This is where everything comes in. So the cleaner we can keep that, the more, not just dental problems we can avoid, but the more health issues we can just never have to go through.
Yeah. All right. Well, thanks a lot. Thanks for joining us for Your Filthy Mouth.
Thank you.
This has been Your Filthy Mouth, a weekly podcast about how what happens in your mouth affects the rest of your body. This is important information, so please share it with your friends. Don't forget to hit the subscribe button on YouTube, iTunes, and all the other podcast sites. And drop by yourfilthymouth.com to ask Dr. Chuck a question, or find dozens of links to information about oral systemic health. We'll talk to you next week.